Congress theme we chose was transition for many reasons, because first, transitions are a period of change in a continuity, and it's by definition a risk period for children, adolescents and adults. So transition is also transitioning from mild symptoms or very early marker of a disorder to pre-morbid disorder, and then to full stage disorder. Transition is also transitioning environment, moving from a region of Europe to another one, from a region of the world at war to our countries. We were also interested to highlight transition in organization. For example, what does it mean from a child and adolescent psychiatric system to move, to transition from a healthcare system to a school or a community-based system, like it was recently the case in the Netherlands. Then we were also interested in some risk factors that can provoke a transition. For example, poverty and the stress bound to extreme poverty, or bullying at school. Finally, like always, ESCAP has an ambition to have a Congress that is really geared also towards clinician, practitioner. Many of our attendees are practitioners. They treat children, and so they have a certain number of questions. They want answers to those questions. For example, psychotherapy research. What works for whom? What are the new psychotherapies that are put into place in a certain type of psychopathology? We are also trying to do an effort to give an update on new medication, promising medication that might not yet be on the radar screen of clinicians in their practice. We really do an effort to bring the very best child and adolescent psychiatry and adult psychiatrists. We have a few people coming from the world of adult psychiatry. We do not compromise, I think, on quality of the speakers, and also on their capacity to convey knowledge. I think it's also about the experience of having really people who have a great sense of didactic transmitting their knowledge. There will also be something in for researchers. There will be a community of neuroscience research in the world of autism too, coming in and presenting and exchanging at symposia, but also presenting their new findings. And then there will also be, we tried to set up several symposia based on new medication. What is coming in the next years, especially in terms of neuroprotective type of medication. Where do we stand at? Of course, we have some knowledge in the world of adulthood, but where does it go in children and adolescent psychiatry? We are also interested to promote cross-disciplinary collaboration with other type of specialty, for example, neurologists, or other types of profession. A lot of psychologists are attending. We also do have speech and language therapists who are attending, nurses, people from the world of special education. There are many talks and symposia that are devoted to the world of autism and to knowledge about autism. And this is, of course, of concern to people from special education, speech and language therapy, child and adolescent psychiatry. So it really gathers around also clinical theme, communities of professionals. It is in the ESCAP concept to really bring and share the knowledge from the different European countries. Not only at the Congress itself, by the way, but there also was a really large effort this year to do it online on essential questions for clinicians again. So how do you put refugees' children in the best condition for them to recover and be able to develop their skills, adapt, and bring all their potential to the places where they arrived. What we try to do is strengthen what we did in Madrid and to bring in communities of clinicians to organize several symposia on a topic. So for example, there will be a whole group of experts in autism organizing several symposia. So if your topic of interest is autism, basically you can follow through several days and really be up to date on many topics, going from early intervention to diagnostic tool to new clinical treatment. So really that you have this at your hand. And we do that also for ADHD and Tourette syndrome. And we do that for psychotherapy and the world of the mentalization-based psychotherapy that comes again. Like they were there in Madrid, they will be here again in Geneva. And last but not least, we will also have a whole community of psychotherapists and a presentation from a member of the association, the European Association for Psychopathology, mainly Latin-based society, but that are our friends. They're really part of the community, and we're really looking forward. So again, a very special emphasis to bring things that are pertinent to clinicians and therapists. This is really the audience we try to feed with new things, new research, new knowledge. We're not a specialist congress. We're not an ADHD only or a psychosis only congress. We're really a congress for clinicians that need to have a broad knowledge and need to be updated on the different topic. And then, of course, they have their preference. They go to one type of symposia or the other one. But you have to be able to come out of that congress by knowing what should be known in 2017.